Imagine waking up in the morning and not being able to see the face of a loved one. Imagine waking up not being able to read your phone or read a letter or see the door in front of you. For millions of people, this is the reality of life. Now, most sight loss is preventable if it's caught early enough. And in this video, we're going to go through 5 key things that's going to help preserve your sight and maintain your vision throughout your lifetime. If you're new to the channel, I'm Jag Singh Kainth, a qualified optometrist for almost 20 years. I own an independent practice called Oracle Opticians here in Shipley, West Yorkshire. Let's talk eyes. So to put things into context, your eye health and your prescription are 2 different things. They work hand in hand with each other, but operate slightly differently. The prescription is the lens power that's required for you to see as clearly as possible, and your eye health is the functionality of your eye needed to maintain good quality sight. It's a little bit like a camera. You know, you have the camera body and you have the camera lens. Now, the camera lens's job is to focus the image of the world onto the camera sensor. And the camera body and the camera sensor is what's needed for you to produce the image to the highest quality. Your eye is exactly the same. You know, the lens represents the prescription, whereas the camera body represents your eye health and the functionality. Now, if the lens damages or changes or we need a different focal length, that lens can be interchanged and swapped over at any time. If anything happens to that camera body, no matter how good that lens is, it will not make a difference to the quality of the image. Your eye health is the same. Your prescription will change throughout your lifetime. Health of your eye is what's actually quite important to maintain the quality of vision that you need. If that deteriorates throughout your lifetime, your quality of vision will never be maintained. And that's what we're going to discuss here. 5 key things that will allow you to keep your eyes healthy and keep that clarity of vision as clear as it can be. So coming in at number 5, UV light protection for your glasses. UV light comes in 3 different wavelengths: UVA, UVB, and UVC. Now, UVC light is cut out within the ozone layer, so the ozone layer filters out UVC light, but UVA and UVB generally tend to get through. So it's really important that when you do select your glasses, you opt in to put a UV light protection on. It will help prevent the progression of cataract. It helps reduce the risk of macular degeneration. It also reduces the chances for certain skin cancers around the eyes and the eyelids themselves. The exposure to UV light makes them more vulnerable to conditions such as basal cell carcinomas. It reduces the chances for things like pterygium, a small growth that occurs on your cornea. So it has quite a profound effect in the long term if you just opt for a UV light protection on your glasses. Coming in at number 4, cut down on your smoking and alcohol consumption. Now, we all know that smoking and alcohol is not good for our health, but it's definitely not good for your eyes either. Smoking increases the chances of cataract, macular degeneration, and excessive alcohol consumption can have a huge impact on your optic nerve and its functionality. However, the key thing is that smoking and alcohol consumption increase the chances of diabetes, cardiovascular disease, stroke. The long-term implication for your eye, if these things are uncontrolled, can be quite devastating, especially diabetes. It can be really, really ravaging if it's uncontrolled or left unchecked. So please, if you can, cut down on your smoking and alcohol consumption. Coming in at number 3, a varied diet packed with vitamins. So the food we eat has a huge impact on how healthy our eyes are kept. The trick is make sure that you vary your diet so that it's packed with the vitamins that you need. Vitamin A, which is found in chia seeds, dairy products, carrot, and broccoli. Really, really good for your eyes, very good for maintaining retinal health and good for night vision. Omega-3 found in mackerel and salmon and flaxseed, really good for reducing dry eye symptoms, also very good for maintaining your tear film. Vitamin E, which is found in nuts, is really good for maintaining eye structures and cell repair within your eye. Now, vitamin C, xanthines and luteins found in strawberries, oranges, raspberries, blueberries. Lutein really found in spinach, broccoli, green leafy vegetables. The antioxidant powerhouse and really, really good for your macular health. It reduces the chances of macular degeneration in the long term. So it's not easy to always get these foods and these vitamins in all in one go. Supplementing your diet with good vitamins, good quality vitamins can make all the difference. Coming in at number 2 is exercise. Now, you'd ask yourself, what's exercise got to do with my eye health? Well, any form of exercise is better than no exercise. It reduces your chances for things like diabetes, cardiovascular disease, heart disease, stroke. It really does make a difference in maintaining your bodily functions and maintaining your health overall. Now, the secondary impact of having any of these conditions uncontrolled can have a devastating impact on your eye. Here's an example of a patient that we'd seen recently. She had uncontrolled high blood pressure, and because of that, she had a small rupture in her eye called a branch retinal vein occlusion. And you've got to remember that with changes like this, it's painless and sometimes symptomless until it's too late. So controlling these things early on can make a huge difference to your long-term eye health. So exercise is really crucial and key for keeping healthy sight and healthy eyes. And coming in at number 1, get an eye test. I genuinely can't emphasize this enough. It's the easiest thing you can do. Now, if you've had a sight test within 2 years or your child's had a sight test within the last 12 months, then you're probably up to date and you're doing okay. But if you've not had a sight test for a long time or you're due an eye test, I can honestly say to you, it's the one thing you can do to maintain your eye health. We can pick so many things up in these examinations that can give you information about how your vision is coping, what we can do to help maintain your eyesight, and if there's been a change in your prescription. And we generally tend to want to make sure that we give you the correct advice for you in your circumstances. For a lot of people, having an eye test can create a high level of anxiety, and you fear maybe that you're going to be told something about your eyes or your health that you're not going to like. But I can honestly say to you that the best thing you can do to preserve your eye health is get your eyes tested. We can pick up so many things early on that makes all the difference to you, your sight, and your long-term eye health. So don't delay. If you are due for an eye test, pick up the phone and book your eye examination. It can save your sight. It can also save your life in some instances. So don't fear it, just get it done. So those are the 5 key things that you can do to maintain your eye health. I'm Jag Singh Kainth. This is Oracle Opticians. Thank you for listening. If you're new to the channel, please press the like button. Please press the subscribe button. It really helps us more than you know. And I look forward to seeing you in the next video.